This is a team from Kenya, and I'm very happy that we are here. We are able to have this discussion. It's a dialogue, it's a discussion that is going to make us, or to give us clarity on the PMNCH call to action on COVID-19. But before I go that far, I want to say that it's my pleasure this afternoon in Kenya to introduce or to welcome Dr. Mercy Mwangangi, the Chief Administrative Secretary, Ministry of Health. Welcome, Dr. Mercy. Happy to have you with us. I want also to take the opportunity to welcome the other speaker with us, Elizabeth Adongo, the Senior Advisor to Cabinet Secretary, Ministry of Public Service and Gender, Kenya. Very happy to have you with us. I also want to welcome Dr. Medine Sehal, the UNAIDS Country Director, Kenya. Very happy to have you with us. And I also want to welcome Honorable Sabina Chege, the Member of Parliament for Women Representative for Murang'a, and over and above in this meeting, the Chairperson to the Parliament Health Committee. I also know that we will be here with Pauline Anyona, an adolescent and youth sexual reproductive health rights advocate from Kenya, and a member of Organization of Africa Youth, a member of HENET. I know we have also other people. Tahila is here and colleagues who have joined us. We really appreciate and we welcome all of you. As I speak this afternoon, I would also want to very briefly introduce myself. I'm Dr. Mercy Onsando. I am the Chief Executive Officer of Health NGOs Network, an umbrella organization of health civil society organizations in Kenya, with the mandate of coordinating the civil society and other players and ensuring that we are taking forward advocacy work and that people are able to access quality health services in our country. I'm very happy to start off this very important discussion and meeting. I will be your moderator, and I'm happy to have all of you as speakers, panelists, giving shape and giving input to this very important meeting. Honorable Sabina, the Chairperson to the Parliament Health Committee, will be our rapporteur for this event. Thank you very much, Mheshimiwa, for accepting this great task. So she will pick up the voice and the content that will be presented so that we can see the great value that we leaders in Kenya, and particularly the government and the other players are putting in ensuring that the commitments are brought to reality. May I just say that this discussion focuses so much on the whole issue of the PMNCH call to action COVID-19 commitments, and just reminding ourselves that Kenya is a signatory or signed to this commitment. And not only has Kenya signed, but as a country, we have continued to implement these commitments. It is indeed very important for us to note that taking care of women, children, and adolescents, especially at a time like this, is very important based on the fact that we all know this is a vulnerable category of people. That when challenges like COVID-19 hit, we do know certainly that women, children, and adolescents, of course, will be affected much more than any other category, as it has been very, very clear. Now, this PMNCH call to action on COVID actually took place because we really want to protect the gains that women, children, and adolescent health and well-being over the last 3 decades has achieved, and we cannot leave this to go away. However, we note that these gains are now severely threatened by COVID-19. And we know as a nation, we are struggling, we have challenges. We do want to really recognize that we are seeing a lot of morbidity and deaths due to COVID-19 virus, and therefore we need to do everything that we can so that we can protect our people from the destruction of these pandemic, and particularly protect the women, children, and adolescents. It is December 2020 that we signed to these commitments. And in our commitments, we are very keen on sexual, reproductive, maternal, neonatal, and child health issues. We are very keen on social protection, and we are very keen in protecting and preventing violence against women, children, and adolescents. Of course, I know as a country, because we've had dialogues, that we have great commitment to ensuring that there's great integration to all the other asks to ensure that none is left behind. So this afternoon, as we start off our discussion, we are basically here to discuss and have our voices shape how well we are able to continue with the work of promoting and ensuring the PMNCH call to action on COVID-19 are implemented and that they are benefiting the citizens. We will actually be able to draw some of the best practices that we have seen or we have demonstrated as Kenyans in ensuring that we are well coordinated and that we are ensuring that we have the commitments signed by the government of Kenya are implemented. And as I said, to benefit women, children, and adolescents. We are happy to be here. I want to continue welcoming you. And please, as you come and as you in this particular meeting, it's my prayer and my request that we continue putting our input and our discussion in the chat. So I want to move straight away to the whole discussion and just talk a little bit and say, HENET as Health and Youth Network did take an action to socialize the Kenyans and socialize the Kenyans, the citizens, so that we could have, on the PMNCH call to action, so that we could have a common understanding and we can do plans, or we can plan better to ensure that these commitments are achieved. We've done a number of things. We've been able to engage with the government offices. We've been able to engage with the civil society, the media, the youth, and other players, because we know we cannot win alone, but together and in a coordinated way, we will win much more than we think. So I want to take this opportunity as a panelist to allow me to now take you to specific areas so that we can start our discussion appropriately. To start this discussion, our first panelist is Pauline Anyona. I'm hoping, Pauline, you are with us. Are you in, Pauline?
Yes, I am, Dr.
Thank you very much. So we are very happy to have Pauline. Pauline is, as I said, is a youth adolescent from Kenya, and she has been very active. So Pauline, in the whole discussion of PMNCH call to action, I want you just to tell us how the youth community in Kenya has been mobilized to leverage the commitments for powerful advocacy. As you answer that question, you could also tell us what are the outcomes of your partnership with the government to enhance community engagement and mechanism for the commitment delivery. Over to you, Pauline.
Thank you so much, Dr. Mercy. So as a young person and working with an organization that represents adolescents and youth in my country, we organized for a session with our cabinet secretary in the Ministry of Gender and Public Service. So the commitments that Dr. Mercy is talking about to the PMNCH call to action on COVID-19 was made last year by the Cabinet Secretary, who is Professor Margaret Kobia, on behalf of the government of Kenya. And the youth, I represented the youth to have a discussion, we held a candid discussion with the Cabinet Secretary. And through our discussion, we were able to dive deep. And as a result, she was able to make a commitment on behalf of the Kenyan government to, she made commitments to 4 of the points in the COVID-19 call to action by PMNCH. And also as a follow-up to enhance accountability, we were able to do a review interview with her within the last 2 weeks, and just to follow up on progress and to know how far she is, and also how far her office is and the government as a whole in the implementation of some, if not all, of these commitments. And so far, so good, because the government has made great steps towards the achievement of these commitments, especially regarding gender-based violence, and also just providing cash cushioning to women and adolescents in Kenya. So that is a great step that the government has taken, although the cabinet secretary thought that the progress is not remarkable, or in her opinion, she felt that it was nothing much to write home about. But in my opinion, I thought that the government has made great progress towards the achievement of these commitments. And also the organization, Adolescents and Youth in Kenya, have also, through HENET, the capacity building that HENET provided, we were able to consolidate, we were able to we're able to sensitize adolescent and youth organizations throughout the country, and also capacity build them on these commitments, and also just let them know about the commitments that were made, especially in the 4 thematic areas that the government talked about. And as a result, the youth are now aware of these commitments, and also we were able to scale up advocacy and accountability at county level. So because these youth are now aware of the commitments, they're able to follow up with the relevant authorities within their counties, and also hold them accountable, just following up on progress, so that we're just not working from a national level, but implementation at county level is also happening. We also have held consultations with youth organizations in all the counties in Kenya, and just to get the progress on status on the implementation of these commitments nationally. So from this, we are working to develop a paper, and the communique is in its final stages of development. And once ready, we will be able to present it and share it with the cabinet secretary in the Ministry of Gender and Public Service, so that she's able to know the thoughts of the youth and their opinion on the progress of the commitments at their level, because they are able to speak better to the impact they're seeing at their level. So the communique will be presented to her, and then from that, we can be able to shape and also shape policies and also adaptations that need to be made, so that the youth and adolescents are not left behind in the implementation of these commitments. Also, we have been able to mobilize and sensitize youth to engage through the social media, because we know that social media is a powerful tool, and we know that at least 1 in 5 youth have access to a phone that can access social media. So we've been having Twitter chats and also just engagements online. We were able to also form a PMNCH Youth Task Force that has representation from all the counties in Kenya. So through this, we are able to follow up on advocacy processes and also get reports on the work they are doing at county level, just to enhance accountability and to make sure that even as they do the work they are doing at on the ground, we are able to document it and also consolidate it, so that we are able to see a greater impact. So that's it from my end, Dr. Mercy. Thank you.
Thank you. Thank you very much, Elizabeth. Anyona, I think that's the name I remember most. Thank you very much. I appreciate that. And as you come in, as you join, I'm seeing you have been joined by quite a number of people. Please ensure that you put your contribution, your questions on the chat, so that we can pick them later on. Thank you, Pauline. I think you can hear what Pauline has shared. And of course, saying that we also have engaged a very important and very vibrant category of our people in Kenya, the boda, the motorbike cyclists. We've already given them this understanding of the commitment, because we know they are on the move every day, every time. And therefore, we want them to be our champion, to be our campaigners, so that this PMNCH call to action can become a reality, and that it can be owned by the community in Kenya. Having said that, I want to take this opportunity to bring in my next, our next panelist, and this is Madam Elizabeth Adogo, the Senior Advisor to the Cabinet Secretary, Minister of Public Service and Gender, Kenya. Welcome, Elizabeth. We are very happy to have you with us, and I want to ask you a few things that will create more clarity to this and add great value to this dialogue. Please, Elizabeth, following the commitments that were announced by the government of Kenya in December 2020, what are some of the institutional efforts that have already been undertaken to operationalize the commitment and make progress towards delivering the results? Welcome, Elizabeth.
Thank you, and good afternoon to everybody. Let me just start by taking this opportunity to acknowledge the distinguished presence of the panelists here and the distinguished ladies from Kenya who are also champions of the health and well-being of women. I'm also truly honored to join in this discussion and wish to thank the UN family of Kenya, HENET, and the WHO who have been driving the discussions in the Lives in the Balance Summit. As guided, let me just go through some of what I would say the institutional efforts that the government has made in relations to the commitments, the commitments that was made in the 7 areas, all in different degrees, depending on the local context or the agency at that time. And my points are around 6 areas. As Pauline mentioned, the commitments that were made by the whole of government was presented by our minister, Professor Margaret Kobia. But although she was in the area of gender, the whole commitments was a whole of government commitment. So in the 6 areas that I'd like to focus on is really looking at those institutional efforts that have underpinned Kenya's efforts. The first one has been that the efforts that the government has made has been based on an integrated approach to delivering in this period of COVID. And this has also been more about looking at multiple, looking at a framework where you're involving multi-agencies. And that is because, as we've seen with COVID, it's dealing with areas of inequalities, it's economic, it's social, and in other areas more so. So you find that some of the efforts we have made, and I'll come back to a special focus on SGBV, we found that all the approaches has been it has been about bringing multi-agencies together. That comes from, the COVID, the national COVID response team, looking at a specific area. We're looking at the multi-agency on the fight against sexual and gender-based violence. We look at, even in terms of the 2 levels of government, there's been a lot of multi-agencies, and also because it was also bringing all the partners on board. And that has been one of the key things that has been put forward in most of the areas. The second area has really been about the use of evidence-based to make sound policies in this period, whether be it through data. And a lot of the issues that we have had to deal with have been informed by real data collected. We have had to look at data regarding the prevalence of gender-based violence, youth unemployment, looking at other areas in terms of economic disempowerment. So the government's approach has really been informed by the data, and that has kind of helped in the sense that we are able to make policies that design policies that are focused on not just the response, but also in terms of looking at the recovery at this particular time. And particularly around the soundness of the policies that we have been attempting to make, has been looking at some of the things that we need to have in place. So you find the Kenya National Bureau of Statistics was then able to even look at capture what impact what impact COVID was having on people across health, across employment and across many other areas. So that through that, a number of the agencies were then able to then work through that. And that has informed some of the progress we are making on the commitments. The other thing has been around strengthening capabilities at all different levels, whether it's through HR, whether it's through knowledge, whether it's through increasing, capacity, strengthening, information, even through resources. And we've seen that across health. We've seen that in the social, the safety net. We've seen that within our own, in the public service, because it was understood that if the public service is supposed to lead in terms of response, in terms of recovery, then we really need to look at our capabilities and how we are able and where the gaps are. And we found, there's been areas where, we've had to recruit at such short notice, where, training has had to be undertaken, and where also, in terms of bringing in expertise, whether it's through partnership or bringing in consultancies, that has happened. And that has also helped in terms of making sure that, the public service remains, able to be responsive as well as fit for purpose. On the other area is that although these were ongoing, but what we found is that in this period, we've had to also hasten some of the reform agendas, particularly in the area of universal healthcare. And that has even, and with a special focus on service delivery, because that has enabled us then to be more responsive. And that has been seen even within the, the UHC, the NHIF, and at even the service delivery in around the Nairobi metropolitan. We have found that certain reforms have been hastened so that we can continue to deliver for the citizens. The other last point before I come to the focus on SGBV has been really reinforcing the commitment for results. And the commitment in Kenya, we have what we call our performance contracting or performance management framework. And during this period, in the last financial year that was leading to this current financial year, where we design our performance contract, we had to quickly look at it, quickly look at the indicators, make sure they're speaking to these commitments, making sure they're speaking to them, to looking at how results are still forecast despite having to live in a very volatile situation. And these indicators, and also in terms of even how we measure, because what we've done is we've moved to automation and lessening where people have to now do face-to-face interaction, which was going to become a barrier. And therefore, this commitment for results has given more impetus to government in terms of making sure that we are delivering, making sure that we are actually tracking what we are doing. On the general, I think Kenya's approach has been really about addressing inequalities. So you find when we're in the areas of social security, safety nets, it has been about working with the vulnerable, working with young people who are unemployed, looking at women, and that has been very, very useful, because we have remained true to making sure that we're also dealing with the other side of the pandemic, which is looking at the inequalities. But allow me, before I finalize, to just give you one specific area where I think in terms of our efforts, not undermining the others, but looking at the area of sexual and gender-based violence. When the pandemic started, this was one area which came to our attention based on the evidence and data that was coming across, is that there was a large and significant increases in number of women who are now facing gender-based violence because of a number of reasons. And this was then given a very high-profile attention at the cabinet level, and even at the highest level, where the president then ordered for an evidence-based research to be done on the issues, find out what the underlying causes were, the nature of GBV that was taking place, and then propose what would be the potential solutions. And then that was also matched with the high-level commitment, leadership, and what it ended up is then Kenya has put in place a multi-agency framework to address the issues of GBV. And that has really helped and enabled us to really deal with the issues. Of course, elimination is still a challenge, but it's one of the areas where we can see a lot of effort has gone in, a lot of results, are beginning to put in place. And as a result of that research and the commitment, we have now set a number of toll lines. There is rescue centers that have been put in place. There's a lot of agencies, a lot of focus on sensitization and campaign going on at the moment, and also support to the victims, as well as bringing in the law, all the different institutions working within this complex facet of GBV. So I think that is just one of the areas. Like Pauline mentioned, we don't think we're there yet. There's still a lot to be done, but there's good progress that we're making, and we will continue to work in partnership with the PMNCHA partners, both at the local level and international, to keep an eye on the commitments that have been made. Thank you very much.
Thank you very much, Elizabeth. We really appreciate. I am just very impressed. And I know in Kenya now, GBV is an essential service. So you can see the progress that we are making to ensure that PMNCH call to action on COVID-19 are achieved. I can see I'm being asked to request whether the panelists can put their cameras on. So please, if that is comfortable with you, I request that you put your camera on so that we can see you and we can remember. When we see, we remember. So indeed, I agree that we are moving on well, and I want to request that we continue putting our comments, our input, our questions on the chat, so that we can make this dialogue achieve what it's meant to achieve. We are here to dialogue on the call to action, PMNCH call to action on COVID-19, look at what we've been able to do, the challenges, the results, and be able to say what next. As we hang on the balance because of COVID-19, we need to be looking for answers. I want to bring to you our next panelist, that is Dr. Medine, the UN AIDS Country Director. Welcome, Dr. Medine, and allow me to appreciate you for being here and allow me to ask you a few questions. Dr. Medine, what are some of the opportunities that the UN partners have leveraged to integrate the commitment made by Kenya as part of your ongoing national support to deliver coherent efforts for implementation? And what has been achieved so far? Over.
Yeah, thank you so much, Dr. Mercy, for the introduction and inviting me to this important panel discussion. Allow me to start to congratulate the government of Kenya for the high-level political leadership and the whole government approach to the COVID-19 response, as well as the commitment made to the PMNCH call to action on the COVID-19. As you know, the UN partners with the government of Kenya through the UN Sustainable Development Cooperation Framework, and we use that as an entry point to partner with the government in order to make sure that Kenya achieves its vision of 2030, as well as the big four transformative agenda, as we all are aware. So the UN leveraged its comparative advantage of convening, connecting, and catalyzing multi-sectoral partnerships, innovations, and investment, basically to accelerate the implementation of the SDGs and supporting the national COVID response, leaving no one behind. Even if we are in a very challenging time, in fact, it became even more important to really deliver on the SDGs, and that's what we do in partnership with government, all stakeholders, including NGOs and others. To your question on how we are integrating the PMNCH call to action, I'm actually very happy to see the alignment between the outcome in our cooperation framework and the 7 call to actions. Just to highlight few, the Sustainable Development Cooperation Framework focuses mainly on 3 strategic result areas. meaning on good governance, human rights, gender equality. The second one is on inclusive growth, environment, and climate change. And the third one, which I want to focus more, the equitable social and human capital development. So if you see the outcome areas of the human capital development, I can say almost all the 7 call to action points are very much, aligned to what we have prioritized under the human capital development. Just to mention a few, the equitable access and utilization of quality health services, including sexual reproductive, maternal, newborn, and child health, in short, the SRMNCAH. This is top priority. And then secondly, girls, boys under 5 years old, pregnant and lactating women, to have equitable access and use quality nutrition, which is again another one related to the call to action. And the equitable access to quality HIV prevention treatment is another outcome area. And the WASH, the drinking water, sanitation, this is also another outcome area under that particular strategic result area. So you can see that our priorities in the cooperation framework are very much aligned to what the call for action are. That is one. So that is our entry point to integrate and to ensure that we partner with the government to deliver on those areas. So as part of the cooperation framework coordination structure, we also have what we call the UN H6 Health Partnership that harnesses the collective strengths of the agencies that are participating as part of the H6, meaning UNAIDS, UNFPA, WHO, UNICEF, UN Women, and the World Bank Group. So we come together again, programming and supporting a coherent and integrated support towards the achievement of universal health coverage, which is one of the big 4 agenda, advancing again women's, children, and adolescent health. So as part of this H6, in fact, I'm happy to report to you that we just concluded a 5-year joint program last year, focusing on the high burden counties, meaning Migori, Isiolo, Wajir, Marsabit, Lamu, and Mandera, that used to contribute almost 50% of the maternal death at national level. So the program focused mainly on the RMNCAH, HIV, GBV, and sexual reproductive health, again focusing on this priority population, meaning women, children, adolescents, young people, and key population. I think one of the lessons from this joint program basically is to harness the multi-stakeholder partnership, including public-private partnership, NGOs, and mobilizing resources to address the critical gap in this area, the RMNCAH, while we also advocate for increased resources, domestic resource, to sustain the gains that have been made. So the other opportunity is we have the SDG partnership platform that Kenya launched in 2017 at the UN General Assembly, that became our cooperation framework flagship to accelerate the SDG impact and catalyzing the SDG multi-stakeholder partnership. And this is now built in support of, again, the Kenya's Big 4 agenda, of which universal health coverage is one. And the primary healthcare window, again, focuses, mainly puts the women, children, young people, at the center and front to catalyze investment in primary healthcare. So that is also another opportunity that we have. So I think what I can say is, all in all, our cooperation framework is coming to an end in 2022. Right now, we are in the process of developing the next 5 years cooperation framework, and this gives us an opportunity, again, to better position and integrate the call to action and deliver on those, obviously, in partnership with the government, under the leadership of government, and partnering with all development partners, communities, NGOs. So I think that's what I can present now. But before I conclude, we know that His Excellency, the President, is the global champion of the Generation Unlimited that focuses mainly on young people in general. And the Kenyan GENU, which we call it in short GENU, the Generation Unlimited chapter, was launched recently. Again, that puts young people at the center, and to make sure that young people can benefit from the program, the economic dividend. And that is also another great opportunity for all of us to collaborate and integrate many of the call to actions. That's what I would like to contribute at this point, and I would be happy to come back if time allows. Thank you so much. Over to you, moderator.
Thank you. Thank you very much, Dr. Medine. We appreciate. I know we will come back for more, but we are happy to have you as a great partner to these commitments. Allow me to bring in Dr. Mercy Mwangangi, the Chief Administrative Secretary, Ministry of Health, Kenya. Dr. Mercy, welcome. I know you are very busy, but I know you are a very great champion and committed leader in regards to this commitment. Allow me to ask you a question, Dr. Mercy. What would you say are the government's needs to accelerate commitment fulfillment?
Thank
and
you.
What is your ask to the PMNCH partner, the national and global level? Welcome, Dr.
Thank you so much, Mercy, and thank you to the fellow panelists for giving us this platform today to be able to discuss the PMNCH, investments and commitment areas. And let me begin by saying that we want to really thank all the partners who saw it important to come together and to really, should I say, celebrate the word P for partnership when it comes to maternal and child health services. In Kenya, we stand by 3 key commitments. That includes ensuring that we have 0 preventable maternal deaths, 0 unmet need for family planning, but also reducing to 0 cases of gender-based violence. And over the years, I must say, the government and together with its partners have been able to put the money where their mouth is and invest when it comes to RMNCH services. I do recall about 4 years ago, the year 2015, we were investing about 1 to 2 billion Kenya shillings in this particular area, particularly when it comes to harnessing and aligning partnerships. And over time, we've seen consistent engagement by government when it comes to MNCH services. Most notably, we've been able to roll out what we call the Linda Mama program. This is a flagship project by His Excellency Uhuru Kenyatta in Kenya, whereby we've seen the availability of skilled delivery services for women who may be burdened when it comes to financing for that service. And so this was then another additional 5 billion when it comes to MNCH services. And further to this, around 2019, 2 years ago, again, through advocacy, through engagements with partners, yourselves, particularly in this room, Mercy, I think we were able to mobilize resources for family planning activities. We were able to perhaps move towards more domestic resource mobilization. And this saw an inflow of almost 8 billion Kenya shillings again coming into this space. And so when we look at it collectively, and particularly when we look at the UHC agenda, I think another key investment is that if you look at the UHC benefit package, the entitlements that Kenyans will have from that benefit package, you can see again further commitments by government when it comes to maternal, newborn and child health services. And so cumulatively, and it becomes important for me to start to this point, is that at the end of the day, as we bring partners together, the idea is that we want to look at our resource basket. We want to ensure that the resources are in the basket, but also that these resources are aligned towards government's need and priority, and that these resources bring about efficiencies when it comes to service delivery. And so when we look at our investment case in Kenya, we need close to about 25 billion Kenya shillings to be able to execute and make investments in MNCH services. We have a gap of about 10 billion. And perhaps when we have discourse together, like in a platform that we are having today, the question is to ask ourselves, how do we meet this 10 billion gap as partners? Are there areas of inefficiencies that we can identify? Are there areas of duplicity that we can identify? Are there potential opportunities of integrating service delivery structures to be able to then perhaps reduce this gap, especially now when we know that the world is going through great global disruptions when it comes to the economy. And so really the resource basket is limited the world over. I'd like to perhaps then sort of deep dive into those three main commitment areas that we have. When it comes to the zero preventable maternal deaths, we appreciate lots of what the evidence shows us when it comes to preventing maternal deaths. And we've been able to put in place different programs that target different, should I say, logic frameworks or concepts when it comes to reducing these maternal deaths. One of the key things that we've been doing is that we've had great political support and patronage when it comes to maternal health in Kenya. Her Excellency, the First Lady, is a champion of the Beyond Zero initiative. And I can tell you, having been an implementer, and I'm now a policy designer, but once I was an implementer in the field, Beyond Zero has really bridged gaps when it comes to perhaps, should I say, ASAL counties or areas where you have great distances between health facilities. And that has been essential in shining a light to maternal health services. And of course, then providing the needed discussion around it, the needed noise around it, the needed advocacy around it, and the needed resources around it. We've been able to celebrate gains in Kenya, particularly when it comes to skilled birth deliveries. We moved from 67% to 75%. And really this is attributable to all the partners who are here. I am happy to see Medine here. I'm happy to see youth champions here, because all that effort saw then the increase of this number from 67 to 75. Of course, this has been coupled by other government initiatives where we have a free maternity service that's running. Of course, also our refocusing onto quality. It's important to note that, once our skill delivery rates jumped all the way to 75%, then the focus now, particularly for government, becomes the big question of, are mothers getting quality health services? Are these services leading to good outcomes, to good health outcomes? And so we're looking to see how we can utilize some of the policy frameworks we have in Kenya, like the Kenya Quality Model of Health, engaging with partners, paying a bit more attention when it comes to MBDSR, so maternal audits, death audits, to be able to perhaps even have that space elevated, get greater commitment from the leadership in the ministry, but also greater commitment from the Office of the President. I do remember a time when all maternal deaths had to be reported all the way to the Office of the President, and this really did help shine a light on these cases and provide the needed advocacy when it comes to this area. In terms of FP, like mentioned, we are really moving towards what we would call self-reliance when it comes to the procurement of these commodities. We've had partners, PMNCH implementing partners and agencies support us in this, right? We've had the World Bank, we've had UNFPA play very strong supportive roles in ensuring that we have more resources. FCDO, former DFID, have also played a key role in this area. And so really just celebrating the role of partnerships in providing FP commodities, but also in capacity building measures when it comes to family planning. One of the things that Kenya is doing, and we're actually about to scale it up, is the self-administration of family planning commodities, particularly through the support of BMGF and other partners. We're looking to see how we can scale up this intervention as one of the many approaches that are available that of course have the dual benefit of providing the service, the family planning service, but also reducing the stress on the healthcare system, particularly when it comes to workloads. And so these are some of the should I say, successes that we can celebrate when it comes to family planning in Kenya. When it comes to gender-based violence, a lot of engagements, particularly with sector partners, like the Ministry of Gender and Violence, and I'm happy to see Elizabeth here. They've been partners with us when it comes to putting in place measures for GBV guidelines, call centers, particularly in the age of COVID. We all appreciate that some of the gains that had been made in reversing, and stemming GBV were eroded because of the pandemic. And so we've been working together to be able to invest further in this space. I think one of the things that deserves a special mention would be ending violence against children. One of the, should I say, documents that was released early on in the beginning of the pandemic, actually, that was really addressing for all forms of violence against children and the need for governments to continue investing in that space and protecting the resource that our children are. And so again, with partners, with civil society, there's a lot of work right now that is underway in Kenya when it comes to looking at setting up safe houses, when it comes to capacity building the workforce, sociologists who work with, the victims of this, when it comes to even raising awareness in communities, engaging the religious leaders, engaging all the different champions in the community. And I think most notably for us in Kenya is the recent success we've had when it comes to FGM, which is a form of GBV. We've most recently been able to engage with some of the high burden communities, who practice FGM. And the president was actually able to come out with a communique and a joint memorandum of understanding with some of these village elders to be able to stem FGM. And we've now, for the first time ever, and I was in that ceremony in one of the counties in Kenya known as Samburu just a few months ago. I was there and I was talking to some of the girls there, and for the first time ever, the girls told us that now they too can speak against FGM just because one of the village elders was able to stand and speak out against it because the president, had brokered that agreement. And so for the first time, the women there are feeling empowered to also put their voice in when it comes to FGM. And really that's commendable. And we hope to then, of course, extend this goodwill to other communities, and then, of course, continuously engage the village elders and leaders to continue supporting our campaign on stopping of FGM. In terms of, you've asked what the ask would be to the PMNCH partners. One, I think, as we ask is to appreciate. Already a lot of work has been executed under this partnership, and that is worthy of commendation, and we thank you all for that. However, we need to continuously remember, at the end of the day, particularly due to the constraints that the world is facing, we have to ensure that there's efficiency in resource use. And so platforms like these today, platforms where you can plug in and have some form of accountability, transparency when it comes to resources, and then ensuring that there's a form of alignment. And while I appreciate that, different implementing partners may have different focus areas, it would be helpful to have us all come together, in some shape, way, and form, identify areas of duplicity and try and integrate those. And then, of course, be able to work towards government identified priorities. So I think that's one of the key asks that would be important. I think the space of R&D, particularly implementation research, remains very important as implementing partners and agencies. More resources are required to asking some of those questions which may be, classified as anthropological when it comes to the practice of medicine, because we all know what causes death of mothers. I think everyone now, the world over, is aware of, postpartum hemorrhage and sepsis and, obstructed labor, all the causes that would, lead to a mother dying. I think the next question is, while we know these are the interventions and we are putting money in different interventions, why are we not able to get to those targets? What are those perhaps socially based nuances that we need to pay attention to as we continue in meeting and trying to pursue our objectives for PMNCH? So other than that, it's to appreciate all of you. I hope I haven't gone over my time, and to continue extending government support to the efforts of the PMNCH platform. Thank you.
Thank you, Dr. Mercy. We really appreciate, and thank you for great work. We may not comment a lot, but we will continue commenting. And thank you for recognizing the partners' contribution and the fact that we need to have platforms for accountability and planning. Allow me to bring in our next panelist, and this is Honorable Sabina, the chairperson to the Parliament Health Committee. Honorable Sabina, welcome. And allow me to ask you a very brief question. And that is, how has the Parliament of Kenya been involved in providing oversight for the delivery of the commitment made by the government?
Thank you very much, and thank you for this opportunity. The role of Parliament, of course, is to oversight what the government is doing. And at the same time, we are able really to give the resources that is required through budgeting process. And this week is quite an interesting week. I was with Dr. Mwangangi yesterday, and we are trying to work on the program to see how much money the government can allocate to health, and to make sure that the most important areas are taken care of. So this week, as we are working on our budget of 2021-2022, we are quite keen, and we went through that process yesterday with Dr. Mwangangi, and we are also going through the other agencies, government agencies that are taking care of healthcare in Kenya, to make sure that the resources allocation that are required are there. Of course, it has never been enough. And so we have faced several challenges, but ours is to make sure that we are able to have enough resources. The government of Kenya has existing structures and systems that facilitate the said committees in Parliament to oversee the efficient and effective implementation of programs and on delivery of commitments. And so being myself the chair of Health Committee, my role mainly is to ensure that the Ministry of Health departments and other related ministries that directly affect the health of Kenyan population are providing the proper health care services to Kenyans. And as my committee, the Parliamentary Health Committee, has been keen to ensure that the budget allocation towards the commitment in the Ministry of Health and the Ministry of Gender before approving the budgets. And the Parliamentary Health Committee has also supported the Ministry of Health for by being champions of PMNCH to call to action commitments. And I also want to thank Hennet because we were able, apart from myself being a chair of health, several women who are members of Parliament were able to have a session and really discuss on the commitment that our country made, and to see how we as parliamentarians can be able to really become champions. And I'm proud to say I'm one of the champions. And we have several other women members of Parliament who are in the caucus of Kenya women parliamentarians who have really given their commitment to go out there. The advantage that we have as members of Parliament is that we're able to go to the grassroots and interact with the women, with the adolescents, with the children. When COVID hit, we had a big challenge because of the teenage pregnancy. That was really a big challenge. And some of us has really gone in to see how we can be able to facilitate and make sure that even when these young girls deliver, they're able to go back to school. Personally, I have a program of making sure that these girls come back to school, which has been a big step. And what we have agreed with their parents is that the parents will take care of the child. When this girl, I take the responsibility of giving them scholarships to come back and learn, to make sure that they don't get wasted or get lost on the way. Gender-based violence has really been also a big challenge within this COVID time. And so I'm very happy with the Ministry of Gender for the commitment. And we had before what the plans are through the CS of gender. I'm proud that we're also trying to have even gender-friendly police stations where we can be able to really assist these women. When I go back, if I go back to the issue of the Parliamentary Health Committee, we were supported also by Hennet through virtual forum to understand the PMNCH commitment and also recruit members present as RMCAH+N champions, ambassadors, and the commitments are their main agenda currently. Kenya has about 10 champions for the commitment, and we are continuing through Hennet to recruit more champions. So through the Forum for the Women, through the Health Committee, we are getting more champions. And I would like to say that the Parliamentary Health Committee that I lead has been closely monitoring what's the progress of implementation of the commitments by attending feedback meetings with the stakeholders, as a recent case I gave with the Ministry of Health, Ministry of Gender and Development Partners for Health and Civil Society Organization. And we are proud to really work with Hennet and would want to further our commitment that not only through Parliament, not only through legislation, not only through giving budget allocation, but also doing the sensitization and advocacy at the grassroots level where we are voted in, and being able really to make sure that these commitments are well honored and that our people benefit, especially during this tough period of COVID-19, where our communities are facing several challenges. I thank you.
Thank you very much, Honorable Sabina. We are very grateful. Thank you very much. I think those are great sentiments that are coming from our leaders. And probably because I know this meeting is being recorded, I know people have friends in other countries have asked me, how come that Kenya, you really move your agenda forward? And you're always among the front runners, even to sign documents, and we see you talking about them. And the truth is that we have always worked as a team for the benefit of our people. Thank you, each and everyone. and I know that there are many things. But I have a few questions as we talk. There are very few questions that I've received from our panelists, from our listeners or the participants, that we would want to have them answered. I have very few questions, and I want to encourage that we all continue putting our comments, our questions on the chat. We may not answer all of them, but we can create a way of answering. We will endeavor to respond to all the questions, even after this meeting. I have a question for Pauline. Pauline Anyona, please prepare yourself to answer this question. And the question is, what capacity strengthening needs does the youth committee require, especially to ensure proper advocacy and accountability to the commitment?
Thank you so much, Dr. Mercy. So some of the capacity building needs would be around capacity building on proper accountability, so that accountability processes, so that young people are able to move forward. And we know that advocacy without accountability does not quite much bear results. We would also appreciate linkages to opportunities that whereby we can engage, so that we are able to reach more people and also get more people working on the same, towards achieving the same goal. It would also be great to get financial resources, so that we're able to convene more of these meetings. As you know, engaging young people, even if it's virtually, still requires financial support. So we have to support these young people so that we're able to engage them even virtually. So financial resources, so that we are able to engage more people and even involve them more in the accountability and advocacy processes is very important. And last but not least would be technical support. So if we could get technical support on how to, during the whole process of engagement with the youth task force, it would be very important, because having a third eye, or having an eye that's able to point us to maybe some loopholes that we may be overlooking would be very important. And especially having a third eye that's more experienced in the accountability and advocacy frameworks that we have. Thank you, Dr. Mercy. I hope that sufficiently answers your question.
Thank you very much. I do have a question, and thank you very much, Pauline. I have a question for Dr. Mwangangi. I thought this question, you are in a better position to answer it. I know it was directed to Elizabeth, but I'm sure you have more information. Kindly, Madam Mwangangi, let us know the framework, or the framework, so the cabinet framework. Are there timelines, especially for NHIF reforms, to include SRHR issues or family planning issues in the benefit package, essential benefit package?
Thank you. Thank you, Mercy, for that question. Indeed, Elizabeth is correct. Cabinet has been looking at proposals that we've sent to them on the UHC benefit package. And one of the key proposals that are there are to actually extend the availability of family planning services to outpatient services. So currently, the current situation, and I may be wrong here because this could have already been passed through cabinet if I'm not wrong, is that you can only access family planning services while admitted. So most of these other services that would be available post delivery or on admission, you'd be able to get most of them being the long-term methods. What we've done with NHIF is that we've extended this, and we've said that any Kenyan woman, of that age who is eligible should be able to access outpatient services and access family planning services. So this has already been ratified in the Ministry of Health, has already been agreed upon by NHIF, and is due for execution. We do anticipate the launching or the setting up of the new scheme in the new financial year. That should be in July. So in terms of timelines, I would say a probable 2 months up to July when we launch the UHC scheme. However, Mercy, allow me to just confirm, the clear timelines with you, the granular details with you, but I'm aware this is something we've already discussed and agreed that the full range of family planning skill mix should be available for mothers, both outpatient and inpatient. It was previously available just for inpatient.
Thank you. Thank you very much, Dr. Mercy. I believe we have answered the question very well. And I know there are so many things that we are receiving from the chat and a lot of appreciation, people appreciating this platform and making great comments that will benefit us. Allow me just now to say thank you very much, our panelists. You have done a wonderful job. I believe we have all gotten a percentage of greater understanding than how we started. I would just want to request our panelists just to give us just to share, each one of us, your top line takeaway. Just in a minute, just your top line takeaway for this meeting as we near the close of the discussion. And I want to start with Pauline Anyona. Over.
Thank you so much, Daktari. So my top-notch takeaway is that we are going to enhance advocacy and accountability processes so that the youth and adolescents are able to follow up these processes so that we have our leaders deliver on these commitments. And we are going to commit to follow it up to the end so that we see that all these processes are actually implemented. Thank you.
Thank you. Over to you, Madam Elizabeth Adongo, your top line comment.
Thank you very much. I want to now shift to the other side of our ministry, which is of public service. And I think with every commitment, what is important is accountability and being able to track, the commitments through the eyes of citizens and getting feedback from citizens. So I think for us, it's how do we engage citizens in the, tracking, in giving feedback with very special focus to service delivery. So as we continue in the 7 commitment areas, working together as a whole of government, it's going to be how do we work with with partners such as yourself? How do we engage young people? How do we engage young people, young girls? How do we engage mothers in being able to look at how these commitments translate to service delivery? Thank you.
Thank you. Dr. Medine, over to you.
Thank you very much, Dr. Mercy. For me, the most important thing is that as we are in the last decade of action for the SDGs, we need to strengthen the multi-sectoral partnership and have an integrated approach to deliver on the results. Because from this panel, we have seen that it's not one sector responsibility, but all of us need to come together and deliver on that. Thank you so much.
Thank you. Thank you very much. And over to you, Dr. Mercy Mwangangi.
Thank you so much, Dr. Mercy. For me, it is to concur with all the panelists, the key words from today: multi-sectoral action, accountability, community participation, and then of course, remembering, as Medine has said, this is the last decade, so we are running out of time. So clearly the partnership needs to be louder and we need to advocate more for the commitments made. So thank you.
Thank you very much. And over to you, Honorable Sabina.
Thank you very much. I think my takeaway is about partnership, that we all need to work closely with each other, honor these commitments, but above all, my commitment to ensure that the UHC works in Kenya through funding, through accountability, transparency, and making sure that we are able to deliver the promise to the Kenyan people, as UHC is one of our main and key agenda within the government of Kenya. And finally is my commitment on championship, because everything needs a champion. We need really to go out there, interact with people, get their feedback, and give out the information that is required out there. Thank you very much.
Thank you. May I take this opportunity to thank all our panelists. Thank you. And thank you very much for a great contribution. May I also take this opportunity to thank all our participants and invites. And I want to take this opportunity also to thank PMNCH for organizing and helping us also as we do this work. May I take this chance to welcome all of you to join the plenary. And the session is officially closed. And thank you very much. I believe what we've discussed will help us a lot and will also help others to learn from what Kenya is doing. Thank you.